It's a disease that started making more and more headlines around the world, prostate cancer. We've seen anyone can be impacted, from the U.S. Defense Secretary to Dr. Martin Luther King Jr.'s son. And new research from the American Cancer Society shows men of color are at an even higher risk. Black men are more than twice as likely to die from the disease than their white counterparts. We wanted to learn more about the recent rise in prostate cancer cases, so board-certified care nurse practitioner and medical expert Dr. James Simmons joins us now. James, thank you so much for being with us. To start off with, what are some of the main causes behind this increase in cases? Is it becoming more prevalent overall, or are we just talking more about it?
I mean, that's a great point. We are talking more about it, but what's really interesting is that the guidelines for screening for prostate cancer changed about 5 or 6 years ago and created what some experts think is a lot of confusion. And so when it comes to the actual screening guidelines, when persons with prostates should go get screened, who's at higher risk, what does the screening look like? Those guidelines changed a little bit. There's actually 2 sets of guidelines, one from the American Cancer Society as well as one from the U.S. Preventative Task Force. And those 2 guidelines differ a little bit. So the thought is that, a lot of other cancers, the rate of a lot of other cancers is plummeting right now, which is great news. But in prostate cancer, there's been a little uptick in the last 5 or 6 years. And that may be in part because the screening guidelines got a little confusing, even for us clinicians, as among other people who need to have their prostates checked. But then also, we are talking about this a lot more. There's a lot less stigma about talking about prostate cancer. Therefore, more people are going in getting screening, and we're catching more cases.
Yeah, more awareness, always the first step. Will you talk about the different groups that are more at risk? The CDC found African-American men are more at risk for the disease. Will you talk about some of the contributing factors to that?
Yeah, I mean, that's unfortunately, this is a common thing that we hear a lot in terms of Black folks in the United States. You're 1.5 to 2 times more likely as a Black man to be diagnosed with prostate cancer. You are 2 to 4 times, depending on what part of the country you live in, more likely to die from prostate cancer. Even though prostate cancer is generally a very slow growing cancer, it is actually a cancer that we often have a watch and wait strategy. So if we catch it early on, we may say, hey, we're actually not going to do anything about this right now. We're just going to watch it, because the treatment modalities for what we do for people with prostate cancer are also often so aggressive that they actually impact your life more than actually having cancer, right? So just having cancer doesn't necessarily mean you need to do something about it right away, because prostate cancers are often so slow growing, they're not going to impact your life and they're not going to kill you. Unfortunately, in the Black community in particular, Black and brown men have a tendency to have later diagnoses of prostate cancer, meaning it's already in stages 2 and 3, which makes it much more deadly and much more difficult to treat.
Well, definitely something that a lot of people need to go have conversations with their doctors about ASAP. Board-certified nurse practitioner and medical expert Dr. James Simmons, thank you so much for your time.
Thanks for having me.